I do want to introduce our next speaker. I'm the session chair for this one. We're doing mostly neuroinfections, I think. So coming up next is we have Alan's picture. I can't see over there. Alan's picture is up there. Fantastic. So Dr. Alan Aksamit went to medical school at Loyola University, went to neurology residency training at Mayo Clinic, and then neurovirology at the NIH. He practices neurology with a real focus in neuroinfectious diseases at Mayo Clinic in Rochester, Minnesota. Fun fact, first of all, has anyone seen the Ken Burns documentary on Mayo Clinic? It was a 2-hour thing on PBS. Well, if this guy looks familiar to you, because he was on there for a solid 90 seconds, not all in a row, basically over time. And so, in my world, a celebrity. Welcome, Alan Aksamit.
Thank you, Dr. Tosh. I appreciate your kind introduction. My one moment of celebrity in the world. And I want to just extend my thanks again to Dr. Pritt and Dr. Verk, who were kind enough to invite me to this lovely place to talk to you about encephalitis. We're going to talk about principally different forms of encephalitis, and we'll start with some definitions. I don't have anything to disclose. Besides herpes simplex encephalitis, viral encephalitis has no FDA-approved treatments. We'll try to talk about some emerging information about diagnosis of viral encephalitis. We'll go over some older information as well. We'll explore the challenging epidemiology of the changing epidemiology of viral encephalitis, become aware of some new pathogens that are emerging, and then start talking about some of the newer diagnostic applications of molecular diagnosis for viral encephalitis that are emerging, and talk about both their advantages and disadvantages. So just to talk about encephalitis as a definition first, I think it's important to, from a pathological viewpoint, to define what we mean. Encephalitis is inflammation of the brain, but that can be distinguished to some degree from a pathological state of something that causes purulence. So if it causes purulence, we generally tend to refer to that as cerebritis. And so therefore, the encephalitis is the preferred term if we're talking about viral or immune inflammation of the brain that generally, at least at a gross pathological level, is not associated with a purulent reaction. Just as an overview, this is provided in your slides. And by the way,